The nurse has just administered the first dose of omalizumab, Xolair, to a client. Which statement by the client would alert the nurse that the client may be experiencing a life-threatening effect? A. I have a severe headache. B. My feet are quite swollen. C. I am nauseated and may vomit. D. My lips and tongue are swollen. Answer. D. My lips and tongue are swollen. Rationale. Omalizumab is an anti-inflammatory used for long-term control of asthma. Anaphylactic reactions can occur with the administration of omalizumab. The nurse administering the medication should monitor for adverse reactions of the medication. Swelling of the lips and tongue are an indication of an adverse reaction. A client has begun therapy with Theophylline, Theo24. The nurse should plan to teach the client to limit the intake of which items while taking this medication? A. Coffee, cola, and chocolate. B. Oysters, lobster, and shrimp. C. Melons, oranges, and pineapple. D. Cottage cheese, cream cheese, and dairy creamers. Answer. A. Coffee, cola, and chocolate. Rationale. Theophylline, Theo24, is a methylxanthine bronchodilator. The nurse teaches the client to limit the intake of xanthine-containing foods while taking this medication. These foods include coffee, cola, and chocolate. Rifabutin, Mycobutin, is prescribed for a client with active Mycobacterium avium complex, MAC, disease and tuberculosis. For which side adverse effects of the medication should the nurse monitor? Select all that apply. A. Signs of hepatitis. B. Flu-like syndrome. C. Low neutrophil count. D. Vitamin B6 deficiency. E. Ocular pain or blurred vision. F. Tingling and numbness of the fingers. Answer. A. Signs of hepatitis. B. Flu-like syndrome. C. Low neutrophil count. E. Ocular pain or blurred vision. Rationale. Rifabutin, Mycobutin, may be prescribed for a client with active Mycobacterium avium complex, MAC, disease and tuberculosis. It inhibits mycobacterial DNA-dependent RNA polymerase and suppresses protein synthesis. Side adverse effects include rash, gastrointestinal disturbances, neutropenia, low neutrophil count, red-orange colored body secretions, uveitis, blurred vision and eye pain, myositis, arthralgia, hepatitis, chest pain with dyspnea, and flu-like syndrome. Vitamin B6 deficiency and numbness and tingling in the extremities are associated with the use of Isoniazid. Ethambutol, Myambutol, causes peripheral neuritis. The nurse has a prescription to give a client salmeterol, Ceravent discus, 2 puffs, and beclomethasone dipropionate, Cavar, 2 puffs, by metered dose inhaler. The nurse should administer the medication using which procedure? A. Beclomethasone first and then the salmeterol. B. Salmeterol first and then the beclomethasone. C. Alternating a single puff of each. Beginning with the salmeterol. D. Alternating a single puff of each, beginning with the beclomethasone. Answer. B. Salmeterol first and then the beclomethasone. Rationale. Salmeterol, Ceravent discus, is an adrenergic type of bronchodilator and beclomethasone dipropionate as a glucocorticoid. Bronchodilators are always administered before glucocorticoids when both are to be given on the same time schedule. This allows for widening of the air passages by the bronchodilator, which then makes the glucocorticoid more effective. The nurse has given a client taking ethambutol, myambutol, information about the medication. The nurse determines that the client understands the instructions if the client states he or she will immediately report which finding. A. Impaired sense of hearing. B. Gastrointestinal side effects. C. Orange-red discoloration of body secretions. D. Difficulty in discriminating the color red from green. Answer. D. Difficulty in discriminating the color red from green. Rationale. Ethambutol causes optic neuritis, which decreases visual acuity and the ability to discriminate between the colors red and green. This poses a potential safety hazard when a client is driving a motor vehicle. The client is taught to report this symptom immediately. The client also is taught to take the medication with food if gastrointestinal upset occurs. Impaired hearing results from antitubercular therapy with streptomycin. Orange-red discoloration of secretions occurs with Rifampin, Rifabutin. A client has been started on long-term therapy with Rifampin, Rifabutin. The nurse should provide which information to the client about the medication? A. Should always be taken with food or antacids. B. Should be double-dosed if one dose is forgotten. C. Causes orange discoloration of sweat, tears, urine, and feces. D. May be discontinued independently if symptoms are gone in 3 months. Answer. C. Causes orange discoloration of sweat, tears, urine, and feces. Rationale. Rifampin should be taken exactly as directed. Doses should not be doubled or skipped. The client should not stop therapy until directed to do so by a healthcare provider. The medication should be administered on an empty stomach unless it causes gastrointestinal upset, and then it may be taken with food. Antacids, if prescribed, should be taken at least 1 hour before the medication. Rifampin causes orange-red discoloration of body secretions and will stain soft contact lenses permanently. A client is to begin a 6-month course of therapy with Isoniazid. The nurse should plan to teach the client to take which action? A. Use alcohol in small amounts only. B. Report yellow eyes or skin immediately. C. Increase intake of Swiss or aged cheeses. D. Avoid vitamin supplements during therapy. Answer. B. Report yellow eyes or skin immediately. Rationale. Isoniazid is hepatotoxic, and therefore the client is taught to report signs and symptoms of hepatitis immediately, which include yellow skin and sclera. For the same reason, alcohol should be avoided during therapy. The client should avoid intake of Swiss cheese, fish such as tuna, and foods containing tyramine because they may cause a reaction characterized by redness and itching of the skin, flushing, sweating, tachycardia, headache, or lightheadedness. The client can avoid developing peripheral neuritis by increasing the intake of pyridoxine, vitamin B6, during the course of isoniazid therapy. A client has been taking isoniazid for 1.5 months. The client complains to the nurse about numbness, paresthesias, and tingling in the extremities. The nurse interprets that the client is experiencing which problem? A. Hypercalcemia. B. Peripheral neuritis. C. Small blood vessel spasm. D. Impaired peripheral circulation. Answer. B. Peripheral neuritis. Rationale. Isoniazid as an anti-tubercular medication. A common side effect of isoniazid is peripheral neuritis, manifested by numbness, tingling, and paresthesias in the extremities. This can be minimized with pyridoxine, vitamin B6, intake. The nurse is providing instructions to a patient who has a new prescription for a corticosteroid metered dose inhaler. Which statement by the patient indicates that further instruction is needed? Select all that apply. A. I will rinse my mouth with water after using the inhaler and then spit out the water. B. I will gargle after using the inhaler and then swallow. C. I will clean the plastic inhaler casing weekly by removing the canister and then washing the casing in warm soapy water. I will then let it dry before reassembling. D. I will use this inhaler for asthma attacks. E. I will continue to use this inhaler, even if I am feeling better. F. I will use a peak flow meter to measure my response to therapy. Answer. B. I will gargle after using the inhaler and then swallow. D. I will use this inhaler for asthma attacks. Rationale. The inhaled corticosteroid is a maintenance drug used to prevent asthma attacks. It is not indicated for acute asthma attacks. Rinsing the mouth with water is appropriate and necessary to prevent oral fungal infections. The water is not to be swallowed after rinsing. The patient needs to be given instructions about keeping the inhaler clean, including removing the canister from the plastic casing weekly and washing the casing in warm soapy water. Once the casing is dry, the canister and mouthpiece may be put back together and the cap applied. The glucocorticoid may predispose the patient to oral fungal overgrowth. Thus, the need for implicit instructions about cleaning inhaling devices. Use of a peak flow meter assists in monitoring the patient's response to therapy. The medication needs to be taken as ordered every day, regardless of whether the patient is feeling better. The nurse is reviewing medications for the treatment of asthma. Which drugs are used for acute asthma attacks? Select all that apply. A. Salmeterol, Ceravent, inhaler. B. Albuterol, Proventil, nebulizer solution. C. Epinephrine. D. Montelukast, Singulair. E. Fluticasone, Flovent, Rotadisc inhaler. F. Aminophylline IV infusion. Answer. B. Albuterol, Proventil, nebulizer solution. C. Epinephrine. F. Aminophylline IV infusion. Rationale. Albuterol, a short-acting beta-2 agonist, and epinephrine, a beta-1 and beta-2 agonist, are used for acute bronchospasms. Aminophylline can be used for mild to moderate cases of acute asthma. Salmeterol is a long-acting beta-2 agonist that is indicated for maintenance treatment, not acute episodes. Fluticasone as an inhaled corticosteroid. Montelukast as a leukotriene receptor antagonist, LTRA. These types of medications are used for asthma prophylaxis. The nurse is providing instructions about the Advair inhaler, fluticasone propionate and salmeterol. Which statement about this inhaler is accurate? A. It is indicated for the treatment of acute bronchospasms. B. It needs to be used with a spacer for best results. C. Patients need to avoid drinking water for 1 hour after taking this drug. D. It is used for prevention of bronchospasms. Answer. D. It is used for prevention of bronchospasms. Rationale. Salmeterol is a long-acting beta-2 agonist bronchodilator, while fluticasone is a corticosteroid. In combination, they are used for the maintenance treatment of asthma and COPD. As a long-acting inhaler, Advair is not appropriate for treatment of acute bronchospasms. The other statements are incorrect. When evaluating a patient's use of a metered dose inhaler, MDI, the nurse notes that the patient is unable to coordinate the activation of the inhaler with her breathing. What intervention is most appropriate at this time? A. Notify the doctor that the patient is unable to use the MDI. B. Obtain an order for a peak flow meter. C. Obtain an order for a spacer device. D. Ask the prescriber if the medication can be given orally. Answer. C. Obtain an order for a spacer device. Rationale. The use of a spacer may be indicated with metered dose inhalers, especially if success with inhalation is limited. The other options are not appropriate interventions. A patient has a new order for an Ipratropium, Atrovent, inhaler, an anticholinergic drug. The nurse knows to assess for an allergy to which food before giving this drug. A. Shellfish. B. Soy products. C. Peanuts. D. Eggs. Answer. C. Peanuts. Rationale. There have been reported cases of severe anaphylactic reactions to Ipratropium inhalers in patients with allergies to peanuts, and such use must be avoided. The nurse is monitoring drug levels for a patient who is receiving Theophylline. The most recent Theophylline level was 13 mcg per milliliter, and the nurse evaluates this level to be A. Below the therapeutic level. B. At a therapeutic level. C. Above the therapeutic level. D. At a toxic level. Answer. B. At a therapeutic level. Rationale. Although the optimal level may vary from patient to patient, most standard references have suggested that the therapeutic range for Theophylline blood level is 10 to 20 mcg per milliliter. However, most clinicians now advise levels between 5 and 15 mcg per milliliter. When educating a patient recently placed on inhaled corticosteroids, the nurse will discuss which potential adverse effects: A. Fatigue and depression. B. Anxiety and palpitations. C. Headache and rapid heart rate. D. Oral candidiasis and dry mouth. Answer. D. Oral candidiasis and dry mouth. Rationale. Oral candidiasis and dry mouth are two possible adverse effects of inhaled corticosteroids. The other responses are incorrect. Zefirlacast, accolade, is prescribed for a client with bronchial asthma. Which laboratory test does the nurse expect to be prescribed before the administration of this medication? A. Platelet count. B. Neutrophil count. C. Liver function tests. D. Complete blood count. Answer. C. Liver function tests. Rationale. Zefirlacast, accolade, is a leukotriene receptor antagonist used in the prophylaxis and long-term treatment of bronchial asthma. Zefirlacast is used with caution in clients with impaired hepatic function. Liver function laboratory tests should be performed to obtain a baseline, and the levels should be monitored during administration of the medication. Terbutaline is prescribed for a client with bronchitis. The nurse understands that this medication should be used with caution if which medical condition is present in the client. A. Osteoarthritis. B. Hypothyroidism. C. Diabetes mellitus. D. Polycystic disease. Answer. C. Diabetes mellitus. Rationale. Terbutaline is a bronchodilator and is contraindicated in clients with hypersensitivity to sympathomimetics. It should be used with caution in clients with impaired cardiac function, diabetes mellitus, hypertension, hyperthyroidism, or a history of seizures. The medication may increase blood glucose levels. A patient has prescriptions for 2 inhalers. One inhaler is a bronchodilator, and the other is a corticosteroid. Which instruction regarding these inhalers will the nurse give to the patient? A. Take the corticosteroid inhaler first. B. Take the bronchodilator inhaler first. C. Take these 2 drugs at least 2 hours apart. D. It does not matter which inhaler you use first. Answer. B. Take the bronchodilator inhaler first. Rationale. An inhaled bronchodilator is used before the inhaled corticosteroid to provide bronchodilation before administration of the anti-inflammatory drug. After receiving a nebulizer treatment with a beta agonist, the patient complains of feeling slightly nervous and wonders if her asthma is getting worse. What is the nurse's best response? A. This is an expected adverse effect. Let me take your pulse. B. The next scheduled nebulizer treatment will be skipped. C. I will notify the physician about this adverse effect. D. We will hold the treatment for 24 hours. Answer. A. This is an expected adverse effect. Let me take your pulse. Rationale. Nervousness, tremors, and cardiac stimulation are possible and expected adverse effects of beta agonists. The other options are incorrect responses. A Cromolyn sodium inhaler is prescribed for a client with allergic asthma. The nurse provides instructions regarding the side and adverse effects of this medication and should tell the client that which undesirable effect is associated with this medication. A. Insomnia. B. Constipation. C. Hypotension. D. Bronchospasm. Answer. D. Bronchospasm. Rationale. Cromolyn sodium is an inhaled nonsteroidal anti-allergy agent and a mast cell stabilizer. Undesirable effects associated with inhalation therapy of Cromolyn sodium are bronchospasm, cough, nasal congestion, throat irritation, and wheezing. Clients receiving this medication orally may experience pruritus, nausea, diarrhea, and myalgia. The nurse teaches a client about the effects of diphenhydramine, Benadryl, which has been prescribed as a cough suppressant. The nurse determines that the client needs further instruction if the client makes which statement? A. I will take the medication on an empty stomach. B. I won't drink alcohol while taking this medication. C. I will use sugarless gum, candy, or oral rinses to decrease dryness in my mouth. D. I won't do activities that require mental alertness while taking this medication. Answer. A. I will take the medication on an empty stomach. Rationale. Diphenhydramine, Benadryl, has several uses, including as an antihistamine, antitussive, antidyskinetic, and sedative hypnotic. Instructions for use include taking with food or milk to decrease gastrointestinal upset and using oral rinses or sugarless gum or hard candy to minimize dry mouth. Because the medication causes drowsiness, the client should avoid use of alcohol or central nervous system depressants, operating a car, or engaging in other activities requiring mental awareness during use. The nurse is preparing to administer a dose of naloxone hydrochloride intravenously to a client with an intravenous opioid overdose. Which supportive medical equipment should the nurse plan to have at the client's bedside if needed? A. Nasogastric tube. B. Paracentesis tray. C. Resuscitation equipment. D. Central line insertion tray. Answer. C. Resuscitation equipment. Rationale. The nurse administering naloxone for suspected opioid overdose should have resuscitation equipment readily available to support naloxone therapy if it is needed. Other adjuncts that may be needed include oxygen, mechanical ventilator, and vasopressors. A client has a prescription to take Guaifenesin, Mucinex. The nurse determines that the client understands the proper administration of this medication if the client states that he or she will perform which action? A. Take an extra dose if fever develops. B. Take the medication with meals only. C. Take the tablet with a full glass of water. D. Decrease the amount of daily fluid intake. Answer. C. Take the tablet with a full glass of water. Rationale. Guaifenesin, Mucinex, is an expectorant and should be taken with a full glass of water to decrease the viscosity of secretions. Extra doses should not be taken. The client should contact the healthcare provider if the cough lasts longer than 1 week or is accompanied by fever, rash, sore throat, or persistent headache. Fluids are needed to decrease the viscosity of secretions. The medication does not have to be taken with meals. A client with a documented exposure to tuberculosis is on medication therapy with Isoniazid. The nurse is monitoring laboratory results and determines that which laboratory value indicates the need for follow-up. A. Platelet count 325,000 cubic millimeters, 325 times 109 lb. Serum creatinine 1.0 milligrams per deciliter, 88.3 mc/mol L. C. Blood urea nitrogen, BUN, 20 milligrams per deciliter, 7.1 mmol L. D. Aspartate aminotransferase, AST, 55 UL. 55 UL. Answer. D. Aspartate aminotransferase, AST, 55 UL. 55 UL. Rationale. Because isoniazid therapy can cause elevated hepatic enzymes and hepatitis. Liver enzymes are monitored when therapy is initiated and during the first 3 months of therapy. They may be monitored longer in the client who is older than 50 years of age or who abuses alcohol. The normal AST level is 0 to 35 UL, 0 to 30 UL. The other options are not monitored routinely and are also normal. A client diagnosed with active tuberculosis has been prescribed a combination of Isoniazid and Rifampin, Rifabutin, for treatment. The nurse teaches the client to perform which action? A. Report any change in urine color. B. Take both medications with food. C. Take both medications together once a day. D. Expect to take the medication for 2 to 3 weeks. Answer. C. Take both medications together once a day. Rationale. Rifampin in combination with Isoniazid prevents the emergence of drug-resistant organisms. This combination, taken together daily, eliminates the tubercle bacilli from the sputum and improves clinical status. Rifampin produces a harmless red-orange color in all body fluids and should be taken along with the Isoniazid 1 hour before or 2 hours after eating to maximize absorption. The treatment regimen is maintained for at least 6 months for effectiveness, and the therapeutic effect may be evident in 2 to 3 weeks. A client with an exacerbation of chronic obstructive pulmonary disease has been on oral glucocorticoids and is currently being weaned to triamcinolone, Asthmacort, by inhalation. The nurse determines that the client understands the potential adverse effects to watch for during this medication change when the client states the need to report which signs and symptoms. A. Chills, fever, and generalized rash. B. Vomiting, diarrhea, and increased thirst. C. Blurred vision, headache, and insomnia. D. Anorexia, nausea, weakness, and fatigue. Answer. D. Anorexia, nausea, weakness, and fatigue. Rationale. The client being changed from oral to inhalation glucocorticoids could experience signs of adrenal insufficiency. The nurse teaches the client to report anorexia, nausea, weakness, and fatigue. Other signs that can be detected and are objective include hypotension and hypoglycemia. Isoniazid is prescribed for a child with human immunodeficiency virus infection who has a positive MAN2 tuberculin skin test result. The mother of the child asks the nurse how long the child will need to take the medication. For how long should the nurse tell the mother the medication will need to be taken? A. 4 months. B. 6 months. C. 9 months. D. 12 months. Answer. D. 12 months. Rationale. For children with human immunodeficiency virus infection who demonstrate a positive MAN2 tuberculin skin test result, a minimum of 12 months of treatment with isoniazid is recommended. The nurse is administering a dose of Terbutaline, Maxair autoinhaler, to a client. The nurse should monitor for which side adverse effect of this medication. A. Drowsiness. B. Hypokalemia. C. Hyperglycemia. D. Increased pulse. Answer. D. Increased pulse. Rationale. Terbutaline is an adrenergic bronchodilator. Side and adverse effects include tachycardia, hypertension, chest pain, dysrhythmias, nervousness, restlessness, and headache. The nurse monitors for these effects during therapy. The other options are not side and adverse effects of this medication. A client who experiences allergic rhinitis asks the nurse about a nasal corticosteroid. How should the nurse reply? A. Clear the nasal passages after use. B. Take the medication only as needed. C. The medication should start to work immediately. D. The medication works locally and decreases inflammation. Answer. D. The medication works locally and decreases inflammation. Rationale. Intranasal corticosteroids may be used to treat allergic rhinitis. The medication works locally and decreases inflammation. The client should be instructed to clear the nasal passages before use for best medication effectiveness. The client should take the medication regularly as prescribed in order for the effect to be achieved. The medication may take several days to achieve maximal effect because it works by decreasing inflammation. The nurse is caring for a client with a diagnosis of influenza who first began to experience symptoms yesterday. Antiviral therapy is prescribed, and the nurse provides instructions to the client about the therapy. Which statement by the client indicates an understanding of the instructions? A. I must take the medication exactly as prescribed. B. Once I start the medication, I will no longer be contagious. C. I will not get any colds or infections while taking this medication. D. This medication has minimal side effects, and I can return to normal activities. Answer. A. I must take the medication exactly as prescribed. Rationale. Antiviral medications for influenza must be taken exactly as prescribed. These medications do not prevent the spread of influenza, and clients are usually contagious for up to 2 days after the initiation of antiviral medications. Secondary bacterial infections may occur despite antiviral treatment. Side effects occur with these medications and may necessitate change in activities, especially when driving or operating machinery if dizziness occurs. A patient develops increasing dyspnea and hypoxemia 2 days after heart surgery. To determine whether the patient has acute respiratory distress syndrome, ARDS, or pulmonary edema caused by heart failure, the nurse will plan to assist with A. Obtaining a ventilation perfusion scan. B. Drawing blood for arterial blood gases. C. Positioning the patient for a chest X-ray. D. Insertion of a pulmonary artery catheter. Answer. D. Insertion of a pulmonary artery catheter. Rationale. Pulmonary artery wedge pressures are normal in patients with ARDS because the fluid in the alveoli is caused by increased permeability of the alveolar capillary membrane rather than by the backup of fluid from the lungs, as occurs in cardiogenic pulmonary edema. The other tests will not help in differentiating cardiogenic from non-cardiogenic pulmonary edema. A patient with acute respiratory distress syndrome, ARDS, and acute kidney injury has the following drugs ordered. Which drug should the nurse discuss with the healthcare provider before giving? A. Gentamicin 60 mg IVB. Pantoprazole, Protonix, 40 mg IV circa sucralfate, carafate, 1 gram per nasogastric tube D. Methylprednisolone, Solumedrol, 60 mg IV. Answer. A. Gentamicin 60 mg IV. Rationale. Gentamicin, which is one of the aminoglycoside antibiotics, is potentially nephrotoxic, and the nurse should clarify the drug and dosage with the healthcare provider before administration. The other drugs are appropriate for the patient with ARDS. Which diagnostic test will provide the nurse with the most specific information to evaluate the effectiveness of interventions for a patient with ventilatory failure? A. Chest X-ray. B. O2 saturation. C. Arterial blood gas analysis. D. Central venous pressure monitoring. Answer. C. Arterial blood gas analysis. Rationale. Arterial blood gas, ABG, analysis is most useful in this setting because ventilatory failure causes problems with CO2 retention. and ABGs provide information about the PaCO2 and pH. The other tests may also be done to help in assessing oxygenation or determining the cause of the patient's ventilatory failure. The prescriber has changed the patient's medication regimen to include the leukotriene receptor antagonist montelukast, singular, to treat asthma. The nurse will emphasize which point about this medication. A. The proper technique for inhalation must be followed. B. The patient needs to keep it close by at all times to treat acute asthma attacks. C. It needs to be taken every day on a continuous schedule, even if symptoms improve. D. When the asthma symptoms improve, the dosage schedule can be tapered and eventually discontinued. Answer. C. It needs to be taken every day on a continuous schedule, even if symptoms improve. Rationale. These drugs are indicated for chronic, not acute, asthma and are to be taken every day on a continuous schedule, even if symptoms improve. These drugs are taken orally. A patient is in an urgent care center with an acute asthma attack. The nurse expects that which medication will be used for initial treatment? A. An anticholinergic such as Ipratropium, Atrovent. B. A short-acting beta-2 agonist such as Albuterol, Proventil. C. A long-acting beta-2 agonist such as Salmeterol, Ceravent. D. A corticosteroid such as fluticasone, Flovent. Answer. B. A short-acting beta-2 agonist such as Albuterol, Proventil. Rationale. The short-acting beta-2 agonists are commonly used during the acute phase of an asthmatic attack to reduce airway constriction quickly and to restore airflow to normal levels. The other drugs listed are not appropriate for acute asthma attacks. Anticholinergic drugs and long-acting beta-2 agonists are used to prevent attacks. Corticosteroids are used to reduce airway inflammation. A patient is taking a xanthine derivative as part of treatment for chronic obstructive pulmonary disease. The nurse will monitor for adverse effects associated with the use of xanthine derivatives, such as A. Diarrhea. B. Palpitations. C. Bradycardia. D. Drowsiness. Answer. B. Palpitations. Rationale. The common adverse effects of the xanthine derivatives include nausea, vomiting, and anorexia. In addition, gastroesophageal reflux has been observed to occur during sleep in patients taking these drugs. Cardiac adverse effects include sinus tachycardia, extrasystole, palpitations, and ventricular dysrhythmias. Transient increased urination and hyperglycemia are other possible adverse effects. A patient is taking intravenous aminophylline for a severe exacerbation of chronic obstructive pulmonary disease. The nurse will assess for which therapeutic response: A. Increased sputum production. B. Increased heart rate. C. Increased respiratory rate. D. Increased ease of breathing. Answer. D. Increased ease of breathing. Rationale. The therapeutic effects of bronchodilation drugs such as xanthine derivatives include increased ease of breathing. The other responses are incorrect. A patient who is taking a xanthine derivative for chronic bronchitis asks the nurse, "I miss my morning coffee. I can't wait to go home and have some. What is the nurse's best response? A. I know how you feel. I'd miss my coffee too. B. I can get some coffee for you. I'll be right back. C. It's important not to take coffee or other caffeinated products with this medicine as it may cause an increased heart rate as well as other problems. D. You've been on this medicine for a few days. I can call your prescriber to ask whether you can have some coffee. Answer. C. It's important not to take coffee or other caffeinated products with this medicine as it may cause an increased heart rate as well as other problems. The nurse is teaching a patient about the inhaler Advair, salmeterol, fluticasone. Which statements by the patient indicate a correct understanding of this medication? Select all that apply. A. I will rinse my mouth with water after each dose. B. I need to use this inhaler whenever I feel short of breath, but not less than 4 hours between doses. C. This medication is taken twice a day, every 12 hours. D. I can take this inhaler if I get short of breath while exercising. E. I will call my doctor if I notice white patches inside my mouth. Answer. A. I will rinse my mouth with water after each dose. C. This medication is taken twice a day, every 12 hours. E. I will call my doctor if I notice white patches inside my mouth. After the patient takes a dose of an inhaled corticosteroid, such as fluticasone, Flovent, what is the most important action the patient needs to do next? A. Hold the breath for 60 seconds. B. Rinse out the mouth with water. C. Follow the corticosteroid with a bronchodilator inhaler if ordered. D. Repeat the dose in 15 minutes if the patient feels short of breath. Answer. B. Rinse out the mouth with water. During a teaching session for a patient who will be receiving a new prescription for the LTRA montelukast, singular, the nurse will tell the patient that the drug has which therapeutic effect? A. Improves the respiratory drive. B. Loosens and removes thickened secretions. C. Reduces inflammation in the airway. D. Stimulates immediate bronchodilation. Answer. C. Reduces inflammation in the airway. A patient has been receiving an aminophylline, xanthine derivative, infusion for 24 hours. The nurse will assess for which adverse effect when assessing the patient during the infusion. A. CNS depression. B. Sinus tachycardia. C. Increased appetite. D. Temporary urinary retention. Answer. B. Sinus tachycardia. Rationale. One of the adverse effects of 24 hours infusion with aminophylline, xanthine derivative, is sinus tachycardia, a condition characterized by increased heart rate. The infusion was for 24 hours, and the possible adverse effect of such infusion does not include depression of the central nervous system, CNS. Increased appetite also is not an adverse effect of aminophylline, xanthine derivative, infusion for 24 hours. Also, 24 hours infusion of aminophylline, xanthine derivative, infusion does not cause temporary urinary retention as an adverse effect. After a nebulizer treatment with the beta agonist albuterol, The patient complains of feeling a little shaky, with slight tremors of the hands. The patient's heart rate is 98 beats per minute, increased from the pre-treatment rate of 88 beats per minute. The nurse knows that this reaction is an A. Expected adverse effect of the medication. B. Allergic reaction to the medication. C. Indication that he has received an overdose of the medication. D. Idiosyncratic reaction to the medication. Answer. A. Expected adverse effect of the medication. Rationale. Feeling shaky, and the heartbeat of the patient has gone up from 88 beats per minute to 98 beats per minute. These symptoms are known adverse effects of the administered drugs and are not allergic reactions to the drug. The symptoms do not reflect an overdose of the drug. Idiosyncratic reactions to medications are not always predictable and vary on an individual basis. However, the symptoms as felt by the patient in the given example are not idiosyncratic but expected adverse effects. When a patient is taking parental xanthine derivatives such as aminophylline, the nurse should monitor for which adverse effect. A. Decreased respirations. B. Hypotension. C. Tachycardia. D. Hypoglycemia. Answer. C. Tachycardia. A patient is status asthmaticus and has not yet responded to epinephrine. The nurse will expect which drug to be used next? A. Albuterol, Proventil, B. Aminophylline, C. Cromolyn, D. Singulair. Answer. B. Aminophylline. Which drugs act by blocking leukotrienes, thus reducing inflammation in the lungs? A. Albuterol, Proventil, B. Cromolyn, C. Theophylline, D. Singulair. Answer. D. Singulair. For PTS taking a leukotriene antagonist, the nurse should include which information in the point teaching? A. If a dose is missed, the patient may take a double dose to maintain blood levels. B. The patient should gargle or rinse mouth after using the inhaler. C. The medication should be taken at the first sign of bronchospasm. D. Improvement should be seen within a week of use. Answer. D. Improvement should be seen within a week of use. The nurse is teaching a group of PTS about the use of bronchodilators. It is important to remind them that using bronchodilators too frequently may cause which adverse effects? Select all that apply. A. Blurred vision. B. Increased heart rate. C. Decreased heart rate. D. Nausea. E. Nervousness. F. Tremors. Answer. B. Increased heart rate. D. Nausea. E. Nervousness. F. Tremors.